And welcome back to the show. Thank you so very much for joining us. I want to introduce you to a group of people that a lot of people in our area already know, but some things that you probably don't know about some of the opportunities that you have for making a positive difference in your life. For our left, we have Dr. Vinod Nair. Dr. Nair, welcome. Thank you for being here.
Thank you.
Yes, sir. Next to him, Ms. Amanda Lapeyrouse, LPC and CIT, Tobacco Cessation Program Coordinator. Welcome.
Welcome. Thank you.
Yes, ma'am. I appreciate it. And next to them, Dr. Jody Stagg, cardiologist with CIS. Welcome.
Hey, Keith.
All right.
How you doing?
All right. Now, listen, smoking cessation is a really big deal, and a lot of people don't know about some of those opportunities. Dr. Stagg, tell us a little bit about maybe why smokers should try to quit.
Well, Keith, smoking is the #1 health hazard we have in the United States, and in South Louisiana, it's really terrible. 1 out of 4 people smoke cigarettes here.
Wow.
And we're trying to get that down to less, 1 out of 5 at the least.
Okay.
Smoking accounts for over half of all cardiovascular and cancer-related deaths.
Wow.
People smoke at an enormous, they still smoke at too high of a pace or too high of a concentration.
Right.
And if you go in, if you look at cigarettes and you take what's actually in them, there are over 4,000 toxins in cigarettes. And I was just reviewing this. There's something called polonium-210,
okay,
which is a nuclear isotope. It's a radiated, it's chemical that's in cigarette smoke. Formaldehyde, that's what we put things in that preserve them for the rest of their lives. That kills tissue. That's in there. Arsenic, a poison, is in there. The people that smoke a pack to a pack and a half a day, just the radiation from polonium gives them the same as getting 300 x-rays a year. Now, this is amazing. It really is amazing. And it accounts for almost all of preventable cardiovascular and cancer-related deaths can be attributed to cigarettes. And the thing that's so important to me, and I know I was going to preempt your question there, but I have a special interest in it. And I ever since my, at an early age when I was a medical resident and then a fellow in cardiology, my mom got lung cancer and died at an age younger than me. She died at 53. And now I have grandkids. And she's never got a chance. She just barely saw my kids. If she hadn't smoked, because her other siblings are still alive in their 80s, she would be alive. And every time I see my grandkids, I think, I got to keep working at helping people get off of cigarettes, because if somebody else can benefit from this little story, so much the better.
Wow, and it's such an interesting story too, because it's personal for you. And as a doctor, people listen to that. But it's not only something that you can share the facts and figures about the 4,000 carcinogens and all of the things that are in cigarettes, but it's personal. And you look at your grandkids. That's something that should make a difference to people. And your mom would have had maybe a much healthier life like all of her siblings have.
Yeah.
Wow. So tells the importance of that. Now, you guys have a program, a tobacco cessation program at CIS, and there's this new feature that you guys have just included in it.
Well, we've been, for the last couple of years, there's the Louisiana Smoking Trust that's provided patients in Louisiana, and certainly in this area where smoking is one of the, again, I don't have to reiterate, but how severe a problem it is. We've now treated over 1,900 patients for smoking cessation. These are people that have been chronic smokers, smoked for a significant period of time, and they come in, it's all free. And when I say that again, it's all free. You can't beat free.
No.
All right, so free is good. Louisiana covers it. Patients can come in, they get free medications, they get free medical visits, and we've just incorporated with Amanda a program that's going to begin in March where they get group counseling, which is one of the best ways of helping people continue getting off the cigarettes. We can talk to them, we can work with them, we can give them the medicines, but if they have some fellow people that are also smoking, fellow smokers, and train people to help work with them get off cigarettes, it's going to make an amazing difference. Again, we've seen over 1,900, I was talking to Amanda today, in our group, and my personal experience with this is over half of those people have been able to stop smoking, which is amazing, and an enormous amount have cut down, where they used to smoke a pack and a half of cigarettes, and with intervention, with medications, they now smoke maybe 3 or 4 a day, or 2 or 3, and they're working to get to 0. We want them at 0. That's the key.
Right.
And those are the things that are going to make a difference. That's the next step in making our local area and our world, but our local area healthier, is getting cigarettes out of the picture. And it's going to be we're working at it. We're committed. We're even more committed now with group counseling and getting this program to all of our centers throughout South Louisiana, and helping our local areas people, our people. It's not just patients, it's our people.
Sure.
Help get off this terrible problem.
Wow, I like it. Dr. Nair, Dr. Stagg mentioned a little bit about the number of people that are doing that. Tell us a little bit about what OMS is and how that plays a role here.
Okay. OMS stands for Objective Medical Systems, and this is an information technology company.
Okay.
We're working very close with CIS to develop various products, one of which is particularly looking at cigarette smoking.
Okay.
And we're planning to do, as Dr. Stagg mentioned, we have approximately 1,900 patients that we already saw.
Right.
We're trying to capture different data elements from these patients so that we can look back and see which medication worked. A sort of research study on our own clinic. What worked, what did not work, how did the patient behave if they have diabetes, for example,
Sure.
if they have history of hypertension, how did that affect the smoking, how did the smoking affect them, so that we'll be able to generate our own data and do some sort of analytics.
All right.
With the help of
So
OMS.
evaluating comorbidities that can affect and might affect. And 1,900, that's a very good, we call that an N. It's a very good number for statistical data. So that's terrific to do that. And so it's kind of a joint effort about taking care of what people really need. I like that a lot. So Amanda, let's talk a little bit with you, and then we're going to take a short break. But I wanted to ask you, what does the program offer, and who actually receives the benefits from these?
Well, CIS's Commit to Quit program is actually going to offer a myriad of different benefits.
Okay.
So you already can receive the physician visits as well as medication and individual or group counseling, whatever the patient feels is going to be best suitable for their services.
Okay.
And to be able to qualify for this service is a little tricky because some residents of Louisiana will meet the qualifications for the Smoking Cessation Trust. But at CIS, we're committed to help all patients who are actually wanting to quit using tobacco products.
Okay.
So if you don't qualify for the trust, we'll aid you in finding out what services we can provide for you.
Well, I got to tell you, I'm really excited. As a social worker, you can't hit on a more perfect blend of expert direction,
Absolutely.
doing it for the right reason, and helping people the right way. You know, we know that depression very often, medication and counseling are the two best ways to help people with that. And I'm sure one of the things we're going to find is that there's some of that component of sadness or difficulty that people are going to have, you know, how they get stuck in certain patterns, and they always smoke, so they feel like they always have to. But if we can provide them with enough information, studying what the research shows, provide them with an environment where they feel good about making those changes, we can see some remarkable changes from people. That's really exciting. And so you guys are offering a group dynamic with counseling. How often does that take place? And that's starting in March, right? So this is the new component. So we've done some looking into from some of the other programs about how to offer that?
Yes, our group-based services will start in the second week of March.
Okay.
In the initial phase, we're going to offer the service at 2 different times of the day. And initially, we'll do 2 o'clock and 4 o'clock in the afternoon in hopes to maybe target some of our working class patients as well, if they could potentially maybe work through their lunch and then take off a little bit earlier. Moving forward in the future, we'd like to be able to offer some of those services after working hours, as long as we can coordinate that with CIS.
I love it. And that, I tell you, that component can really solidify some differences for what people are looking forward to. And so smoking is one of those things, I think people are fearful that they just can't do it. And all they need to do is call and find out a little bit more about it. And as Dr. Stagg mentioned, I love the concept, you really can't beat free. Because there's nothing for free.
No.
You can't beat for free. And I love the fact that CIS is really committed to this. So they have physicians following, as well as this counseling piece, and medication that have proven to work. And you guys are pulling all the data from the last 2 years, right? Mm-hmm. Last 2 years to see really how this can make a difference. I love it. Well, look, guys, we're going to take a short break, and when we come back, we're going to talk a little bit more about this wonderful program that you guys have and how some people can find out if it can be free for them.
Perfect.
All right, guys, don't go anywhere. We'll be right back after this short commercial break.